I'm Johnny DiLoretto at the Center for Medical Education and Innovation. In a moment, we are going to see the patient simulator, Stan, undergo cardiac arrest. Stan, are you ready?
I think I'm ready to do it.
Are you sure?
Yeah, I think I can.
Got really nice pecs here, by the way. Do you work out?
I try to keep in shape.
Stan is played brilliantly by Scott Wingfield behind the glass there. Scott will give the performance of his life when Good Day Columbus returns.
You're watching Fox 28. Good Day Columbus starts now.
Well, next time you see a doctor, he or she may have gotten some practice on pretend patients. It's being done at the Center for Medical Education and Innovation at Riverside Methodist Hospital. Johnny DiLoretto is checking out the training. Johnny?
We're now in the VCU. This is going to get pretty intense. It's the virtual care unit, and I'm joined by Dr. Jennifer Beard, and she's going to show us how the team practices to respond to a patient coding, which is what, Dr. Beard?
It's a code blue. It's when a patient undergoes a cardiac or a pulmonary arrest, and we resuscitate them to have a good outcome.
Okay, so let's see what happens when the team responds to a code.
This is B-time. Okay, call the code. Get the code part.
And explain to me what we're seeing, Dr. Beard.
So we're seeing the nurse assessing the patient and determining that a code needs to be called. So they'll activate the emergency response system in the hospital, and a code blue will be called overhead.
Okay.
Now you're seeing the team.
Code team leader.
Go ahead and come in. We have resident physicians, nurses, the pharmacists, respiratory therapists.
This is what would happen in a patient's room. All these people would show up?
All these people and even more.
Charge of the 200.
And you guys would be videotaping this?
We would be videotaping during the whole scenario so that the team can go ahead and debrief afterward and learn from what they're doing.
Everybody clear?
We're seeing CPR being started.
Okay.
They're managing the airway. They're going to go ahead and shock the patient.
We're all clear.
How are they doing? Can you tell?
It looks like they're very effective here.
Let's get 1 milligram back.
Got a good team leader who's delegating the rules to each of his team players.
So a moment before Stan coded, Scott was in another room kind of providing his voice, right? And so now he's just observing this?
He's observing because when an arrest occurs, the patient generally can't speak. So he's observing.
Okay.
He actually controls the scenario through the computer system.
Excellent. All right. When you come on back, we're going to meet the patient, Stan D. Ardman. We'll tell you what that means next.